us to discuss on our strategic plan 2023-2028. Father, I pray that your presence will be thus, Lord, even as we interact with our key stakeholders about our key result areas on our strategic plan. With us, Lord, and continue upholding the leadership of KMTC, the board of directors, chairman, our CEO, Dr. Kelly, and all the senior managers, all principals, all staffs, and the students. Father, we pray that you will continue upholding us with your mighty hand, that it knows no failure. We thank you and I bless you for your goodness and mercies. For in Jesus' name we pray. Amen. Amen.
Amen. Thank you, Mr. Kyoko, for the encouraging prayer. I also want to acknowledge the presence of our board of director chairperson. He will join us shortly. That is Mr. Josiah Cheriot. We also want to acknowledge the presence of our CEO, Dr. Kelly Oluoch, our Deputy Director Academics, Dr. Nyawira Mwangi, our Deputy Director Finance Planning and Administration, Madam Lucy Chebungei, and all our stakeholders from the 10 campuses that are participating during this town hall session for today. Welcome and thank you for your commitment that you've shown in attending this session today. So the Kenya Medical Training College is a state corporation established by an act of parliament and falls under the Ministry of Health. The college has a vital role in training various disciplines in the health sector, conducting research and consultancy. The college has 87 campuses strategically located in 45 out of the 47 counties in Kenya, and KMTC is committed to ensuring an inclusive participation as part of implementing its 2023-2028 strategic plan, reason for us gathering here together with our stakeholders. So the purpose of this town hall is one, to provide a platform to engage our stakeholders in understanding our strategic objectives and priorities. Because remember, as KMTC alone, we will not be able to exist if we don't engage our stakeholders. So that's one of the reasons why we have our stakeholders today, so that they can understand our strategic plan and be able to support one another. The other reasons, we also want to discuss critical aspects of the strategic plan and how we can collaboratively work together towards achieving our goals. We do know our stakeholders have played a very vital role in what we do as KMTC, and we want to have them here today so that we can share. So in attendance, as earlier said, we expect to have our board chairperson, Mr. Josiah Cheriot, our CEO, Dr. Kelly Oluoch, our Deputy Director Academics, Madam Dr. Nyawira Mwangi, and our Deputy Director Finance Administration and Planning, Madam Lucy Chebungei. Also, KMTC students, staffs, and stakeholders drawn from 10 campuses to include KMTC Nairobi, Loitoktok, Maanza, Machakos, Kangundo, Kitui, Mboni, Makueni, and Mutiambua satellite, as well as Makindu. I want to call upon our host to project the poster that we have summarizing our KMTC strategic plan. Mr. Kariuki, kindly project the poster.
Chair, if you can proceed, I need a minute or so. It's taking a while to download.
Taking a while to download, so I can also proceed without the poster. So our KMTC has a vision, and actually we wish to be a globally competitive institution for training human resource for health. Our mission is to develop fit-for-purpose mid-level health professionals through transformative training, research, and consultancy. And our motto is to train for better health. We also have core values that determine our organizational culture, how we conduct our operations. One of them is accountability, that we wish to take responsibilities of our roles, obligations, and results, both individually and collectively. We also embrace integrity in all our activities that we do. We are also responsive to all. For example, when it comes to admission of students, we do not select where they are coming from. We take all of them from across the country, whether from marginalized communities. We do not look at the rest, religion, and even where they are coming from. We also embrace equity. We give equal chances to all who qualify for our courses, even those who are physically challenged. We have a training for them as KMTC. We embrace teamwork, and that's why KMTC, we are where we are today. Like last week, we graduated almost 22,000 graduates because of the teamwork we have as KMTC towards training as a training institution. We also uphold professionalism. All our courses are governed by a profession, and we have a professional etiquette as we train our students in the various disciplines so that we graduate graduates who also will uphold the professional etiquettes of their profession. As KMTC, we have also aligned ourselves to the health and development agendas. We have the bottom-up economic transformation agenda. And here we come in very handy, especially in the Primary Healthcare Act, where we train human resource that can even reach out to those at the Tier 1, at the community level. We are also responsive to the Sustainable Development Goals, especially Goal 3, that talks about health for all. So we train health professionals who can be able to treat all the common ailments within our Kenyan community and even outside. We are also responsive to the universal health coverage. We play a very vital role because we train human resource for health that are able to make sure all of us in Kenya can access equitable and affordable health. We are also responsive to the East African Community Vision 2050 that talks about re-engineering human resources for health. To mean we are able, and we will continue being able, to produce a healthy workforce that can cater for all the elements within our country, East Africa region, and even Africa region. We are also responsive to the African Union Agenda for 2063 that talks about developing health workers that are able to understand and are responsive to the emerging and changing health needs within our community. Our strategic plan is implemented through we have annual work plans, we have performance contracts, we have a budget towards it as we implement the strategic plan. We have resource mobilization, like we also reach out to our stakeholders to assist us implement this strategic plan. We also do capacity building for all our staffs to be able to attain the goals of this strategic plan. We also have risk management. We look at the risk that can make us not achieve the goals of our strategic plan. We have that one in place, and we have a quality management system that guides on what we do in all our activities. And lastly, we have partnerships and collaboration as demonstrated here today, where we are having stakeholders drawn from all our 10 campuses that are participating here today. So our strategic plan is well defined, and it has key results areas that all of us in our 86 campuses are supposed to attain. The first and foremost key result area is quality training. All of us are expected to do quality training regardless of where the campus is positioned. We have a common curriculum that will train, for example, a nurse in Lodwar. That will be the same curriculum that will train a nurse in Lamu or Tana River. So that is one of the ways we measure our quality training. We have research, innovation, and consultancy. Our staffs, even including our students, they carry out research, and it is a requirement that we carry out research so that we can have evidence-based knowledge to be able to carry out our day-to-day operations. There's also digital transformation. We know in Kenya today, this is what all institutions are expected to adhere to, and KMTC is actually very responsible to digital transformation, as we shall hear at a later time today. And also, we also focus on institutional sustainability. Like where we are today, how shall we sustain where to do today and even beyond where we are today? that is what we look at. We also endeavor to monitor this strategic plan very carefully so that we attain what we intend to do, so that by 2028, we shall have realized what we intended to do and even beyond our expectations. So our strategic plan will be monitored through, we have a very robust and competent strategic plan implementation committee. We have our quarterly and annual reports. We have the strategic themes and strategic theme and teams. There are also dashboards. We have outcome matrices, and also we are able to share what we learn. Actually, like here today, we'll be sharing what we are learning from the different campuses that will be presenting here today. So our strategic plan also will be evaluated through midterm evaluation. After 2.5 years, we shall have a midterm evaluation. There's also ad hoc evaluation where this is a need-based evaluation. If you need to conduct it, there's a need for it, it will be done. And also we have an end term that will be done as we approach the end of 2028. So now I want to welcome our next presenter, that is Madam Evelyn, Principal Manza Campus, to take us through our next session. Thank you. And before Madam Evelyn comes, kindly, we will be, I know you have questions, you are welcome to ask questions, but all our questions, kindly direct them to the chats, and we shall have our other panelists who are going to attend to all the questions that will be posted in the chats. Welcome, Madam Evelyn, to take us through the next session. Thank you.
Thank you very much, Principal Makindu, Madam Margaret Juma. My name is Madam Evelyn Nabuga. I'm the principal at KMTC Manza Campus. So at this juncture, we are going to go through the key result areas that are in our strategic plan. And so within these areas, we will have different panelists discussing what we have done so far and what we intend to do so that we meet the strategic objectives. So we'll start off with the first key result area, which is quality training. Under quality training, KMTC has made a deliberate effort to improve the quality of education for health professionals so as to ensure that they get trained and are ready, fit for the market. So the strategies that the college has employed are aimed at improving the quality of training and also helping the graduates become fit for purpose. So at this point, I want us to engage with the Principal Machakos. Principal Machakos, among the strategies that have been put in place is expanding transformative opportunities for students and graduates under quality training. So I want to invite you to tell us, how has this been in Machakos campus, and what have you done so far, and what is your plan in achieving this strategic objective, key result area? Karibu, Principal Machakos.
Thank you, our moderator. My name is Felicitas Mwinde, Principal KMTC Machakos. Yes, as Machakos campus, we strive to cause a major change to our students such that as they get out, they are a whole person. We not only major in academics, but we also major in other areas. We have identified the right placement areas where our students go and they get in touch with the right mentors wherever they go to the hospitals or any other place. We are partnering with different hospitals, private, mission, and also the national government. We also engage the seniors in their lines of duty, such that we invite them for forums where they come and talk to the students and build them in their as they go on with their academic journey. We also expose our students to clinical visits, field visits, where they go and relate what they learn in class with what is happening on the ground. The courses we are offering, they are also marketable courses, and they are open to progress to these students. Regardless of where you are starting from, some start from certificate, they progress to diploma. Others start from diploma, they progress to degree, they progress to masters. We have students who are doing PhD, yet they started the certificate holders in KMTC. So we are saying that our courses are actually competitive, and the students are also working within and outside our country because we are offering competitive courses. Not only are we looking at the academic part of it, we are also looking at the student welfare. We expose our students to different activities, we expose them to games, we expose them to clubs. The recent concluded national sports for KMTC Machakos campus was able to scoop 5 trophies because we are exposing our students to sports. Last week, our SDG club was awarded as the secondary tertiary institution on matters of volunteerism, and the students are engaging themselves in different activities. We have also trained student mentors, peer counselors, where students have been exposed to basic counseling skills. We have 30 students who have already been trained. The students can open better to their peers. However, the peers are also aware of the referral system. If it's a case they cannot handle, we have got a mental health specialist within the college whom they refer to. We also have got level 5 hospital Machakos, where they can go to the support center anytime during the day. They can visit and they'll be supported. We also have the dean's office, where issues to do with social issues can be handled after they have been identified from the department or by their peers. And we also have got policies which also support these students to ensure that students are in safe environment, because we want our students to be all round. We have got the whistleblower policy. Thank you,
Yes,
among
thank
others.
Thank you very much, Principal Machakos. As we can see, the strategies that have been employed so far are aimed at expanding transformative opportunities. Asante sana, Principal Machakos. I don't know if anyone in the session has any question related to this quality training so far, or else if it's not very pressing, you can still write it in the chat. So I'll just give opportunity for 1 or 2 people just to respond or to ask a question or a concern. Then we can proceed to the next key result area.
Yes, our moderator, kindly just proceed. We request that all the questions be posted on the chat. Kindly proceed. Madam Evelyn, proceed.
Okay. Thank you. Thank you, Madam Juma, Chair. So we are moving to the next key result area. The next key result area is research, innovation, and consultancy. Research, innovation, and consultancy. This is a key result area for KMTC that has been formulated to help us achieve the mission of KMTC and remain competitive in today's rapidly changing environment. This key result area, the college has engaged a lot of research activities so that we are able then to provide evidence-based information that plays a role in informing our core mandate. So to this extent, therefore, I want to welcome our next panelist, who is the Principal Mbooni. Principal Mbooni, among the key strategic areas for this KRA or key result area, the strategic areas that the college has put in place include executing science, technology, and innovation. Now, using Mbooni as an example of this particular key result area, I would like you to take us through how then has Mbooni done, what has it done in relation to executing science, technology, and innovation, and what do we intend to do to achieve this strategic key results strategic area? Karibu, Principal Mbooni. Principal Mbooni, Madam Felicitas Kimanzi, the floor is yours. You could take us through how we have, using your campus as an example, how the college has executed so far science, technology, and innovation, what we have done and what we're intending to do. Now she prepares to enter. We could also, in the same key result area, there's a lot of collaboration and partnership that we are trying to enhance as a college. So in supporting collaboration and partnerships, this is one of the areas that we are focusing on in order for us to meet this key result area in the strategic plan. Part of the reason why we have you, our stakeholders who we value so much, because we want to collaborate further and to partner with you so that we can grow our institution and become competitive. We have a better competitive advantage and we become better from what we have been in the past. So karibu Principal Mbooni, Madam Felicitas Kimanzi.
Well, I am not very sure whether Madam Felicitas is hearing us. We'll give her a chance. Kindly let us move on to the next presenter as we get back to Principal Mbooni. Yeah, she has pointed out that she has an issue with network. I've seen in the message, in the chat. So kindly let's proceed to the next panelist as Madam Felicitas, Principal Mbooni, tries to get herself where she can be heard. Madam Evelyn, please proceed with the next presenter.
Thank you. So the next key result area we want to introduce ourselves to, or else to sensitize ourselves on, is institutional stability. So what KMTC has done as a college is to recognize that the institution needs to be stable over time, or self-sustaining over time. So this therefore has been done using our mission, so that in the long term, the strategies that have been formulated will be aimed at, or are aimed at, ensuring that we attain institutional sustainability. Not only sustainability, but also stability. So to this extent, therefore, the strategies that we are employing through our strategic plan include touching on human resource. In order for any institution to be sustainable, we need a proper human resource establishment, and sustainability, especially of the environment in these days of climatic changes and environmental degradation. The college has also played a role in trying to sustain the environment. So Principal Makweni, Madam Mary Kioko, I want to welcome you on board so that you tell us again, using your campus as an example, what has been done so far in relation to institutional sustainability, and more specifically, the key area on human resource and environmental sustainability. Karibu, Madam Kioko.
Thank you very much, moderator. The concept of institutional sustainability means that it is the ability of the college to meet its needs without compromising the quality. This encompasses the issues to do with financial sustainability, environmental sustainability, human resource management, cooperative governance, and institutional reputation. For financial sustainability, the campus has planned to increase the population of the student from 60,000 to 70,000 by the year 2028. This is equivalent to increasing the revenue by 40%. In Makueni, as this has informed us about the increase of the student population, we are planned to increase our student population by increasing other new courses, which are about 4. 2 diploma courses, 1 certificate course, and 1 short course by the March 2025. Also, to sustain the college is through sourcing from grants. The financial year of 2023-2024, Makueni, we are partnered with CDF, and we have been able to get 2 classrooms up to completion by CDF. The same, about 400 students have been funded by CDF, enabling them to continue with their education. About the environmental sustainability, the college contributes in keeping environment clean and green. About the cleanliness, we teach our students on how to keep the environment from class and even the whole environment clean. And also they have contributed in cleaning the markets, especially like Makueni Market. Also, to keep our environment green, this year we have been able to plant around 2,000 trees in conjunction with other partners. Also, we use biodigester. About the human resource management, which is a key, the KMTC employed a number of staff. Makueni, we received about 6 new staff. The staffs, when they are employed, they need to be skilled, they need to conform with the college norms, and these staff were taken for induction workshops. The other staffs who have been there, they have been retrained to gain their skills and also professional development through different workshops. Like from 2023 to date, some staff have attended customer care workshops. They have attended reproductive health updates, strategic management courses, and even skills lab courses. Also, we have appraisals of the staff at the end of every quarter, depending on what they said. We have also staff welfare to enhance bonding and also learning from each other to even build the teams. We have team building and we have also HOD meeting activities.
Thank you very much, Principal Makueni. Thank you very much. Thank you. Thank you. So the institutional sustainability, as you have heard from the case study of Makueni, we want to move on to the next key result area. Probably we could check to see if Principal Mboni is back. Principal Mboni, are you now able to give us the next KRA? So the KRA that Principal Mboni, Madam Felicitas Kimanzi, Research, Innovation, and Consultancy. I don't know if we are ready. Probably we could check. Okay, so as we wait for her to continue to rejoin or to get ready, we move on to the next key result area, which is digital transformation. Now, KMTC today recognizes that in today's rapidly changing healthcare environment, there is need for us to adopt digital transformation mechanisms so that we can be able to improve our customers' experience and also to increase our competitive advantage. And therefore, we have leveraged as a college on digital transformation. And this key result area is aimed at focusing on areas that are related to transforming our digital environment so that we are compliant with the current day status, the current day environment of the rapidly changing environment. So to this end, I want to welcome Principal Loitoktok, Mr. Nicholas Ruto. Probably you could just take us through among the strategies that have been employed, the key areas that the college is concentrating on is a reduction in paper-based processes and also in the strengthening of ICT infrastructure within our campuses. So using Oloitoktok as a sample of what is happening around the entire college, Principal Oloitoktok, Mr. Nicholas Ruto, you could then tell us how have we strengthened the ICT infrastructure as a college, and also how have we moved towards paper-based processes as a college? Karibu, Principal Oloitoktok.
A very good afternoon, Evelyn and panelists and also audience. It's a great privilege to have you this afternoon to take you through our experience at Oloitoktok campus in digital transformation. Evelyn, you've given a great background about our digital transformation, having been aligned to the changing healthcare environment, and also that we are focusing on our customers and also in terms of integration of digital transformation in our processes. To this end, we will look at our areas of that we are focusing on, the key result areas. We are looking at the embracing of the emerging technology. We are looking at the strengthening of the ICT infrastructure. And to start with strengthening the ICT infrastructure at Leitokto campus, we have upgraded our LAN to around 25 Mbps, and we have 4 points of access, 2 for the students and 2 for the staff and administration, areas of points of access. And this has really assisted our processes that we are talking about in terms of easing our work, in terms of reducing paperwork. If we are to start with the areas of admission of students, we admit our students on right from the time of admission, so that our students are enrolled on ERP, that is Enterprise Resource Planning, so that we are able to capture every bit of the journey that the student will be traveling at Kenya Medical Training College, right from admission until the time the student will be exiting the campus. Now, for issues of admission and also enrollment in terms of the teaching and learning, which of course has been covered by the listeners from Machakos, and the issue which also contributes to the quality of training is the issue of embracing the technology, use of computers. We have computer labs. We also use the laptops and in the training, and also LCDs to be able to project our sessions when we are training the students. And again, we also in our examination area, we also process our results in so that we have the student individual score sheets that are e-generated, and we also have the consolidated mark sheets that are e-generated in terms of learning and also providing feedback to the students on learning and assessment. The other areas that we have embraced this is also attendance of the students. We also through the same application program that the ERP, to ensure that our attendance for the students is monitored, and therefore we enroll the students, and attendance is also registered through online, so that the students' presence in the college is recorded. Now, the deliverance of to deliver content also, we have embraced the e-learning so that our students access our information even while they are out of college and they are within, including our library, which is also e-learning. We have the e-books, the students access learning through that. So our library, the student will just walk, key in, and they are able to access and be able to identify the books they want. When they are also being issued books, they are also issued via digital processes. So the students can easily, the librarian is able to tell when books are due, so that we reduce also the issue of loss of books and also the processes in which the students do not overstay with the books. So we do that also to ensure that our students are also accessing content through e-learning or through digital form. Now, the other things that we plan to do are the prometric online. Otherwise, thank you so much. Probably if there will be anything, I'll still add more. Thank you, Evelyn.
Thank you very much, our Principal Oleitoktok. So members, in this chart, you can see the key result areas that we have covered today, that our strategic plan, again, just to emphasize what we have already listened to, you have seen the case studies of our campuses, as we all are a family. So we have just selected these few to see what is happening, and whatever is happening in the individual campuses is a replication of the entire college, of the 86 campuses. So at this point in time, I want us to go to the next session, which is the Q&A, the question and answer. I will hand over this session to Madam Luciana Kaloki, who is the principal at Mbuvo, to take us to the next session, which is question and answers, where we now look at the questions you have posted in the chat and probably give room for maybe 2 or 3 people just to ask. So I hand over this session to Madam Luciana Kaloki. Karibu, Principal Mbuvo.
Thank you.
Thank you, Madam Moderator, for the invitation to respond to the questions. Members, I want to welcome, after listening to what our presenters have taken us through on quality training, on research, innovation and consultancy, on college sustainability, and the digital transformation, I want to take this opportunity to welcome all of us to post our questions in the chat box, or you can do so by also raising your hand and shall be able to respond to a question. In the chat box, I can't see any question in our chat box. If any members are adding question, kindly do so by raising your hand and shall be able to respond to you.
So
Members, you are welcome to ask any question that, or any area that maybe is not clear to you.
Okay. Thank you, Madam Kaloki, for that guide. There are a few questions here that I will read. Then you can guide us on who will take up the answers. Kindly, Madam Kaloki. I'll just read briefly, then you can guide us on who takes on to the answers. The first one is asking, what can you do to help those many students from KMTC fraternity who by choice wish to become lecturers but have only attained diploma level? Kindly, Madam Kaloki, you can attach that question to someone, those of us in this call. Then there's somebody from Alan Malala from Nakuru is asking, what can you do to assist those students who had their diploma from KMTC and now they are willing to be part of trainers as lecturers, mostly for certificate level? I understand the requirement is a diploma degree, but if one had not made to financially upgrade, how can you help to sustain such vision in young men and women from KMTC fraternity? The other question is under KRA, quality training. What strategies have KMTC put in place to check on, number one, limited clinical placement facilities due to competition from other medical institutions? Number two, facilitating KMTC to participate actively in supervision of students at clinical areas. That was from Bernard Ondari. The third question is by Prince Ali. Is asking, as KMTC fraternity, what have you done as a family to respond to such ongoing program to allow health records and information officers work under secure and transparent management like any other cadres? Lastly, can the certification program of transcripts be done electronically to avoid office congestion at the main headquarters? There's also a question by Samuel Gitau. Samuel Gitau is asking, let me just understand. A lot of attention. Okay, good afternoon. I would really like that issue of pharmacy training be given a lot of, okay, this is his insight. It's given an insight on wanting a lot of attention be given to pharmacy training because there seems to be a misunderstanding between the college and regulatory body. The other question, an anonymous attendee is asking, is saying we have a big challenge with mentorship and clinical placement for H&D pharmacy students. The same anonymous attendee is talking about other teaching staffs can other than the teaching staffs getting deployed from clinical stations by the counties, does KMTC consider employing staffs on permanent and pensionable terms, please? And is also talking about H&D pharmacy students, what interventions can be given to them so that they can get permanent and pensionable jobs. Kevin Odawa is talking about the same issue regarding KNQM qualifications and higher diploma.
Thank
The
you,
other
Madam
question,
Moderator. Maybe you can handle a few of those ones which I've already said so that we are able to respond to the members.
okay, go ahead, Madam Kaloki.
Thank you. On question of those who have already attained a diploma from KMTC and would want to be members of teaching staff, because of maintaining our quality, we still encourage you to source for funds and be able to go back to school for higher diploma and bachelor degree in your area of training as a diploma holder as of now, because we have to maintain our quality by ensuring that our students are taught by people who have attained the relevant qualifications for them to be lecturers. And this is a policy issue, and we don't want to lower our standards to allow diploma holders to teach their fellow diploma or even certificate holders. So for now, we just urge you to source for funds, and we wish that you get those funds quickly and be able to enroll for a higher diploma or Bachelor of Science in your area of specialty. On the issue of health records, may I request Mr. Homo to handle that one because he's a specialist in that area. Mr. Homo, kindly handle the question on health records and information. Yes, Principal Nairobi, Homo, kindly. On issues of clinical, as we wait for Mr. Homo to organize himself on issues of clinical sites and ensuring that we decongest the already approved clinical sites, we are still engaging our stakeholders in the hospitals, both in private and public, and entering into MOU so that we can have as many clinical sites approved by regulators as possible, so that we are able to decongest the already approved clinical sites that we are using currently. So it's something we are very cognizant about, and we are working towards mitigating this challenge of congestion in our clinical areas. On higher diploma in pharmacy, Dr. Jesse of Kangudo, principal from Kangudo, maybe you can say something about that because you are specialized in that area. Dr. Jesse of Kangudo, react to the question on higher diploma in pharmacy, please. Maybe Madam Margaret, you could read the other questions as we wait for these officers to come on board.
Yeah. As they prepare to answer, I would suggest Principal Machakos kindly answer the one on pharmacy. Principal Machakos, as I read out the others, Principal Machakos kindly answer the one on pharmacy.
Thank you, moderator. Yes, the issue of pharmacy, what I can say is that this is an issue which is a thorny issue, and headquarter, that is our CEO and his team, is handling this issue. And I know they will be advised on the way forward since this is a regulatory issue. Thank you, moderator.
Okay, thank you, Principal Machakos, for that answer. So the other question is aligned to Bernard Ondari is saying, in relation to alignment to EAC Vision 2050, what strategies has KMTC put in place towards the common market protocol for human capital, with particular emphasis to curricular harmonization for training institutions? Another question from Geoffrey Omondi. Geoffrey Omondi is talking about with the increasing number of students and courses, is KMTC planning to introduce 2 graduation ceremonies in a year? Then there's Sikuku Mwasoza, that's our Assistant County Commissioner Makindu. She's asking, how do we handle students who are physically challenged to ensure they achieve their goals? Madam Kaloki, we can take those ones. Principal Mbuvo, we can take those questions.
On the issue of having 2 graduations, I think that's a policy issue, and because our chairman and our CEO becoming on board, we request that they will be able to handle that, but it is a suggestion which I think is well thought of. On matters physical, how we intend to how we handle our physically challenged students, we have a policy for PINDA PDD, and we endeavor to ensure that our programs allow all inclusive, and therefore even those who have challenges, we also admit them and we make special arrangements for them. Like if they are left-handed, we ensure that 5% of our furniture caters for the left-handed. Those who have visual challenges, our policy provides for extra time during examinations. And we have elaborate arrangements for failures and different kinds of our customers who are failures, challenges, either physically, visually, or even intellectually. Like 2 years ago, we were able to graduate a student who had Down syndrome. We carried her through for almost 6 years, and at the end of the day, she was able to achieve a certificate in nutrition and dietetics. So we are very, very much prepared, and we are ready to take and assist anybody with physical disability, of course, depending on the degree of the challenge. Thank you, moderator. Maybe you could give us another question.
Another question, and this one will go to Principal Makweni. Frederick Mwendo is asking, what are the contingency plans in place to address unforeseen challenges like economic turnedowns or public health emergencies and disease outbreaks? The other question is on quality training. This is from Anthony Mbitu. He's asking, what is KMTC doing to avert the shortage of staffs and for sustainability? This one question will be answered by Principal Manza, Madam Evelyn. The other question is on why is KMTC training HND, yet they don't absorb them in the teaching fraternity. You usually take degree holders, yet HND is equated to degrees. That one will be answered by Principal Mboni. Why do you train HNDs, yet they don't absorb them into teaching fraternity? You usually take degree holders, yet HND is equated to degrees. That is by anonymous attendee. There's again, Bernard Ondari is asking, under KRA on quality training, I meant facilitating, okay, he's just clarifying his question. He meant facilitating KMTC lecturers to actively participate in the supervision of students at clinical placement sites. That question will be answered by Madam Kaloki again. Geoffrey Omondi is asking, with the increasing number of students and courses, is KMTC planning to, okay, that one was asked and it was correctly answered by Madam Kaloki. He's asking whether we can do 2 graduation ceremonies in a year. His other question is on, according to NQM, some HNDs were not listed. Are there plans to update the list? That question can be answered by Principal Manza. Let's take those ones first. Let's answer those questions first. My colleagues, principals. We were starting with Principal Machakos.
Thank you, moderator. Maybe the question I can respond to, the one you told me to respond, is on the issue of clinical placement, ensuring that our lecturers participate actively in clinical area. This one is factored in our workload, and our lecturers are supposed to spend some time in the clinical area with some students. They also do a visitation of the students. So this one is being practiced as we talk now. Thank you.
Okay, thank you, Principal Machakos, for that valid answer. Next, Principal Makweni.
Okay, thank you, moderator. I think the first question is on disease outbreak. In our training, we usually train about surveillance and how to handle the disease outbreak, and we equip our graduates with that. So there is a procedure of managing disease outbreak, of which we usually follow up to date. Then the other one is about disaster management. When we talk of disaster, we talk of before, during, and after. And also, as I have said, we also train our graduates about it, what is expected, what to prepare. And even in our colleges, we have many things we have put in place. Like we have areas where, in case of anything, people assemble. For example, if there is a fire, we also put as required. So there is a policy about it, of which we conform. The other question is about economic sustainability, I can say like that. In college, we have come up actually in the strategic with the risk management, and we have the manager at the headquarters, and every campus, it has come up with a risk management register. So we are broken down to the risks and how to go about them. So that is something handled and something which is we are conforming with. Thank you.
Thank you, Madam Kyoko, Principal Makweni, for that answer. Good answer. The next question will be done by Principal Mboni about training HNDs, yet they are not absorbed as lecturers for KMTC. Principal Mboni.
Thank you, moderator. Yeah, KMTC trains higher national diploma because most of the programs are specialized programs, and we train them, we focus them on providing in-depth knowledge, technical skills in specific healthcare in different disciplines. And therefore, that is the reason why we offer a higher national diploma in different disciplines. Thank you.
Thank you so much, Principal Mboni. So our stakeholders and all those who have attended here, the other questions will be answered on the chat. Kindly, colleagues, principals, just write the answers on the chat so that we can move on to the next session. And at this juncture, I want to call upon our Deputy Director Academics, Dr. Nyawira Mwangi, to take us through the next section. Our DDA, welcome.
Thank you very much. Thank you, Team Nairobi. You've done very, very well. That is awesome. Thank you. And thank you everyone who is on board. So what I will first do is to invite Mr. Edwin Omodi, our risk manager. He will take us for the first part, then I will come in. Thank you, Mr. Omodi, come in.
Thank you. Thank you very much, Tim. Thank you, Daktari. I really want to appreciate this, and I want to acknowledge the presence of the team from headquarters. That is the chair, the CEO, the DDF, and the DDA, our principals, and all our valued stakeholders. This forum is very, very important. And I think we are making a good progress. I want to really appreciate everyone on board. Just briefly, as we do everything, as we execute our strategic plan, we are also taking cognizance of the fact that risks also live with us, and we are trying to manage them to an acceptable level so that all our operations are not affected. So I'm happy someone has noted that, and I'm happy principals are taking it as a very, very important aspect of achieving goals for the KMTC. So allow me to take this opportunity to give back to Dr. Nyawira to steer the next stage of this discussion. Thank you very much.
Okay, thank you very much. Yes, risk is very important. And in the strategic plan, I think we did consider also what risks we might be facing or we might face both now and in the coming days. I want to mention to the audience that we are going to be 100 years soon, and you are working with an institution that has been engaging with the health sector and the education sector, because we work at the intersection of those two, and as well as intersection with the community for almost 100 years. And this particular strategic plan is the one that is going to transition us, then, because we will be 100 years in 2027, just as we will be still implementing this plan. And it is structured in such a way, it is helping us to move even into the next century for KMTC. So during the first century, you are all familiar with the training that has been doing. You're familiar with the expansion. I think almost in every homestead in this country, everybody would know, or at least has heard about a KMTC, and probably they know somebody who has trained at KMTC. We're looking at the impact that we have had, and the aim of this strategic plan is to really give, a transformation. We will want our operations, our impact, everything about KMTC to be really transformative. You might ask yourselves why we are having these town halls, where we are talking about KMTC. It is because we want to respond to the needs. We want to be very responsive to the needs. And like the things you are raising today, I know you have asked, for example, about transcripts, whether it's possible to avoid the long queues. And I want to mention that now, like those who graduated this year, they already have their transcripts. Even before graduation, they had their transcripts. So we are no longer going to have any queues because already, as soon as you finish, you can have your transcript. So this is, again, being addressed. The same to clinical placement. I think we are working with the hospitals, both those in the private and the public sector, so that we have access. As you know, training at KMTC requires the clinical facilities, so the hospitals plus other sites, and we work with them. So right now, we are actually going not only the public, not only the mission, but even the private to really engage with them and see how we can learn from them. So clinical placement is something we are looking into. Non-traditional clinical facilities, just like non-traditional lecturers, we are engaging them. KNQA qualifications, I've had some questions. This is a strength that we are now accredited by KNQA. It is true, it's a progressive process. So as we go on every year, we are adding more and more qualifications. So in case there are some programs that are not yet on the framework, we are doing this to really increase. Curriculum, some questions on curriculum. We are strengthening curriculum. We have a policy on curriculum. We have a framework. We have standard operating procedures. We improve curriculum based on emerging needs. So we work with stakeholders, including our alumni, including health workers who are in the health facilities, so that something that needs to change gets changed. Something that needs to be added gets added. The learning strategies also keep on changing. So the curricula are really dynamic. we've had a lot of interest in a number of courses. I know, like we have the health records, really one of the very important courses in terms of, for example, right now, all of us are talking about data, including artificial intelligence, including, data analysis, data integrity, monitoring and evaluation, and so on. And here, HRI is really important. We have done whatever we would to ensure that they get the right support. Like I think we have now trained everyone on the current ICD, such that in terms of diagnostic classification, we are able to put in that. In terms of diagnosis, we are also training people so that they also use the right codes and all. But also we want them to connect, like now, to take advantage of artificial intelligence, really a very important area to use. There's the issue of pharmacy, again, of big interest. Yeah, pharmacy, a very important program for us. So you realize, for instance, like the very first course we began at KMTC in 1927 was on compounding. Although over the time, drug formulations have changed. Nowadays, we have a packed rather than having to compound. Things have changed, but I'm sure there's still some areas where we do some compounding of some maybe dermatological preparations and others. But we take pharmacy as one of our leading course. That is what we began with, and we are looking to strengthen it even more. In all medicine, healthcare, a lot of it is about products such as the vaccine, such as drugs. So it's an area of big interest. So pharmacy, as much as possible, whether it's attachment, I know you need attachment in various areas. We are looking to strengthen this, including working with pharmaceuticals for industrial attachment, including now that we have a lot on vaccines going in the country. I think those are many new areas. So in general, we have the courses that we offer, they are market-driven programs. They are courses that are of importance, and that is why they still have applicants. If there's anything we want to do is to strengthen this program. So I want to assure all of us, our stakeholders, yes, let's hear how best we can make the experience work for you at KMTC, and also beyond KMTC, how we can get more and more opportunities. Like we want to get you people in pharmacy more opportunities, in the vaccine industry, a lot of that as well. So in the end, stakeholders, we want you to know our plan. We want you to see where you can plug in. We also want you to tell us where we can add in so that your experience is great. Last week, we had our graduation. We have had some feedback from those who participated. And this, one of the interesting things we did this year is that we actually invited previous alumni to come and tell us what they would like about a graduation. Like when they graduated, what was their experience? What do they think we should improve now? And therefore, we have taken a note and we have tried to really improve it. Okay, for them, they did not mention about 2 graduations, I suppose, because they wanted to be a time where they come together, but we have noted that, and one of the things we are exploring, because the main thing, we would want you to get your certificate as early as possible. So we are exploring additional mechanisms where you can get your graduation early. Otherwise, the numbers we are happy with, we are okay. We can, we are happy to have a graduation where people come together, network, and then see how to take it forward. So if there are questions that are not answered, I'm urging principals, please just go to the chat and answer those questions so that all questions are answered. I also want to give you an email, which is info@kmtc.ac.ke. Please, if there are any outstanding issues, we are happy to answer them. Number 2, campus nearest to you, please get in touch. We can answer any questions, or we can take your input and incorporate it in our training programs. So today we've had our principals from the wider region, we would call it Nairobi region, the metropolitan region, so Nairobi and its surroundings. We have quite a number of campuses there. So we have Nairobi campus, we have Karen campus, we have Mathare campus, we have Kagudu campus, we have Booni campus, we have Makueni campus, we have Makidu campus, Machakos campus, we have Manza campus. I believe I've mentioned all those campuses, Ebubo campus as well. So those are the campuses. And today we wanted stakeholders, including students, including health workers, everybody in our ecosystem in that area to be able to join today and find out what is in our strategic plan. The plan itself is available online. So if you just key in KMT strategic plan, it's good to know what we are doing. So I hope you've taken home. We have 4 key areas. So 1, we want to strengthen the quality of training. 2, again, strengthen research. 3, digital transformation. And 4, sustainability. We'll be reaching out to you for more discussions, especially I've mentioned that we are now going to our centenary, and it is you who can tell us how you would want it done, what you remember about KMTC. So look out, we'll be reaching out to you on this. Let me first find out, do we have any addition from Nairobi campus? Anybody would like to add something? Any of our teams from the principals, would you want to add anything, and headquarters before I invite our CEO? Okay, thank you. So I want us then to pay attention now, give it focus, just be really present here. I'm going to be inviting our CEO, Dr. Kelly Olwach, to be able to take on the conversation and tell us from where he sits, what would he like us to know about the strategic plan. Welcome, Dr. Kelly.
Thank you, Deputy Director Academic, and also thank you, principals for various campuses in the Nairobi region and all the participants. Good afternoon to you.
Good afternoon.
Let me begin by registering my appreciation to all of you. I have sat through most of the conversation, and I am very happy to note that the principals who are engaged in this conversation have really taken their time to understand the strategic plan and contextualize it to the realities of their campuses. And also the examples that were given were real life examples that are looking at what the campuses are going through from time to time and how they have implemented the strategic plan in the understanding of their context as campuses. I also want to register appreciation to participants because I've also noticed that the kind of questions that participants are asking are well researched, and they are questions that come from a lot of information and need to know more about what needs to be done concerning various situations that affect the strategic plan. So, ladies and gentlemen, I want to appreciate the fact that this conversation has taken place. However, let me just summarize in most of the areas that we have gone through, starting from the need to have this strategic plan and why did we settle on these key result areas and where are we coming from. For us to develop this strategic plan, it was informed by a lot of stakeholder engagement, where we engaged both staff, students, our other stakeholders like clinical placement sites, counties, our employers, for our graduates, to see what was it that they experienced from our concluded strategic plan, and what recommendation would they have in our strategic plan that we were developing to ensure that the strategy that we were adapting was responding to the changing environmental demands in healthcare training. It is based on this review that is basically looking behind to see the successes, the failures, the challenges, and opportunities that we could have taken in the previous strategic plan, that we then developed the priority areas, looking at the vision, the mission, and looking at what needed to change to adapt to the new realities in the ever-changing health ecosystem. Based on that, we basically moved our vision from a competent, from training competent human resources for health to the current vision of a globally competitive institution in training human resources for health. It also informed our vision, our mission change to enable us to address the issues that were arising. Basically, the matter of fit for purpose human resources for health, given the fact that we now played in a larger, wider environment than the local Kenyan setup. And therefore, we needed to put our health workers into the international arena. And that would mean that we would be training with countries that are not traditionally consumers of our products in mind. And that's why we developed a mission that looked at fit for purpose human resources for health through transformative training, research, and consultancy. And this basically meant that in the quality of training, we had to redefine what quality meant. And here, quality meant that a health worker should be able to provide services in whichever context they choose to go to. And therefore, we developed need for having languages that were not initially part of our training at Kenya Medical Training College. And that is why in our quality training, we had non-traditional targets that basically meant that we needed to do more to put our products, that is our graduates, into the world stage. And I have noted with appreciation that the campuses have actually appreciated this and started to adapt and direct their activities towards that strategy. Then we looked at how then do we define our core values to be able to reflect what we wanted, since the core values dictate the culture of the organization. And it is always said that culture eats strategy for breakfast. And therefore, we meant that in looking at the core values, we needed to actually define them. And therefore, if you look at the strategic plan, we have defined various aspects of core values and what they operationally mean to us as an institution. And that's why you see in our strategic plan, we've gone further than just stating the core values, but we have defined them to mean what they should mean to us in the context of training for fit for purpose human resources for health. And then now we went to look at the key result areas, and looking at the key result areas in Kenya Medical Training College, initially we had a very long list of key result areas. So we had then to sit and organize our thinking, and various group discussions took place in order to condense these key result areas into areas where we could have staff being able to remember them, comprehend them, and be able to deliver on each key result areas. And so we developed the 4 key result areas of quality of training, of research, innovation, and consultancy, of digital transformation and sustainability, institutional sustainability. And basically what we mean by quality of training is that we as an institution redefined what quality meant to us. And therefore we quality in this aspect means that we are supposed to produce human resources for health that can adapt to any environment where they choose to work. And with that came other things that we must do, including being able to have mechanisms for offering training, short courses that then allowed our students to operate in an international environment. And that's why you see that in our strategy, we have NCLEX as part of our preparatory training for those who would want to sit for NCLEX examination, negotiations to have NCLEX examination center in Kenya, making sure that we have TOTs trained on foreign languages and NCLEX, and being able to support our students through their journey to get quality training that is fit for purpose. And then we looked at research, innovation, and consultancy, and realized that there are two elements that are not very, very well pronounced in our previous strategy. And that meant that we would want to look at consultancy with new lenses and want to emphasize it. And therefore, while strategy is an ongoing activity, we want to now focus on making sure that we operationalize elements of the structure of the organization that allows us to manage the aspects of consultancy services, and then being able to look at how then do we use research, how do we improve our conversations, including town hall activities like what we are having right now, to look at how do we learn from experiences, how do we document them, and then how do we use them to inform policy decisions, how do we use them to inform practice, and also how do we use them in order to extend our boundaries of knowledge. And therefore, research, consultancy, and innovation become very key to this organization as it seeks to dominate the healthcare training, not only locally, but regionally and internationally. And therefore, then it is very important for us in this region to look at what is our contribution to this strategic plan. As a campus, how do you advance the agenda of research? How do you ensure that as many as possible lecturers in your campus become part of a conversation in research? How do you strengthen research supervision in the campus? How do you strengthen publishing of research findings? And then how then do you look at research in a wider perspective of how then can we use it to develop proposals for funding and ensuring that the institution has sustainability elements put together in it? So we have a role and responsibility. Where we have reached, we have yet to scratch the surface in terms of research, innovation, and consultancy. And there's so much that needs to be done, and your contribution to this is very key. We realize that we are not able to do this alone, and we require the support and participation of everyone, be you a student, a lecturer, a head of department, or a principal. We need all our hands on the deck to sustain the achievement of this strategic plan. Then we looked at the issues of digital transformation. And as you have realized in the recent past, we've been really moving up to be able to do structural cabling in our campuses. We have joint approaches in discussions with the Ministry of Creative Economy and ICT to be able to look at how do we invest more in the digital space. And for now, you will have realized that the ICT department has written to all campuses seeking to know which kind of bandwidth would support the kind of activities that the campus is undertaking, so that we consolidate and buy bandwidths that are able to support research, consultancy, quality training, and be able to give all of us a cutting edge in this area. And therefore, we have also looked at issues to do with e-learning platform, and I want to thank DDA and her team for ensuring that the e-learning platform is actually up and running and it is used by students. What we need to do in this area is to enroll as many students in the e-learning platform as possible, train them in the use of e-learning platform, and enable them to be contributors in the feedback loop to make sure that the e-learning platform basically adapts to the changing realities. The same goes to our e-library. We have now trained all our librarians on the use of Koha, on the use of open learning platforms, and we've enabled them to use, and we've invested so much on the e-library. So it is up to campuses to use the knowledge that we've given to librarians to support on access to e-material that can enable campuses to train effectively. At the same time, we have an ERP. We have made sure that campuses are connected to the ERP. We've trained both lecturers and non-lecturers on the use of ERP, and we still continue to insist that all activities of teaching and learning, from enrollment into the ERP, attendance registers, missed lesson plans, should be done within the ERP. We formed a small team to support and look at what was not working. And what we saw was that the part-time lecturers were excluded, and they form a large part of the training resources in our campuses. And therefore, we developed a target where we need all of them to be onboarded on the ERP through this team, so that we are able to make sure that everyone fits into the ERP and we're able to see all activities concerning student affairs, teaching and learning, financial matters, and other support services being reflected on the ERP. The enrollment of students and involvement of students in terms of ensuring that we have all that data on ERP is important, so that we're able to track things like attendance, and then we're able to then monitor quality of training through that mechanism. So digital space is very key. Yesterday, as we were interacting in the town hall with the president, it emerged that the digital economy is the next goal for this country. It emerged that most of the work that we are looking for physically partly can be done online, and that business process outsourcing is an emerging bit in our economy, and therefore our students should be made knowledgeable in these areas. As a result of that, and in advancement of our strategy, we discussed with the Ministry of Diaspora and Digital Economy on a job fair that should be conducted within KMTC campuses to update our students on the emerging skills, to update our students on the use of technology and availability of the same technology to accelerate employment, to accelerate learning, and to accelerate decision-making in terms of careers, and whether it should be befitting of them to just look for jobs so they could also be employers. And therefore, we are organizing so that in early next year, we will have other ministries or departments like diaspora together with us organizing job fairs and trade fairs within KMTC that then should bring all these amalgamated concepts together to support both students who we have graduated and now are alumni, and ongoing students, in terms of the looking at and reinforcing the importance of embracing digital transformation. After that, I believe that most campuses and students will see the need for what we are doing and be able to support in our journey towards digital transformation. And finally, there's the issue of institutional sustainability. And we looked at institutional sustainability in many ways. We realized that we can no longer depend entirely on exchequer funding. And we've noticed that exchequer funding, with the kind of challenges that the country continues to face economically, may be an area that, if we don't look at, would affect us. And therefore, we decided deliberately that we would have a department on resource mobilization, engagement of alumni, partnerships and collaborations, and then look at how then do we optimize this to reduce our dependence on exchequer funding. And therefore, and that is why you see that the Department of Academic has really worked on the programs in campuses, has pushed so much so that we have increased number of students, and we have looked at other innovative ways of delivering our content, including hybrid, so that we are able to serve students who are traditionally expected to report to KMTC from January to December. So the conditions in counties fully deployed or released to come and learn at Kenya Medical Training College. We also looked at sustainability in terms of being responsible citizens and making sure that we take care of our environment. And what we did there was to look at how do we make sure that our environments are green, given that we realized that the tree cover, not only nationally, but within even our campuses, was very wanting. And therefore, we have always endeavored to push on ensuring that campuses are able to plant and grow enough trees. And we have done a lot of partnerships, including with banks, to enable them to work with us to make our campuses sustainable in terms of environmental sustainability. Further, we have defined other areas in sustainability in terms of environment, including the cleanliness of our environments, making sure that we reduce wastage, and that's why we say we collect rainwater and make sure that we have biodigesters where we have challenges with our sewage systems. We have also realized that to be responsible corporate citizens, the communities that host our campuses need to see the benefit of KMTC around them. And therefore, we have created in the sustainability framework need to participate in activities that also benefit communities, like doing community diagnosis, medical camps, donation of blood. And recently, we have had training for border borders, even though I'm aware that we still have a challenge in this area, to ensure that our communities become part of KMTC and that they're involved. So looking at all this, what we want to say is strategy needs to be something that is alive with us. Every single day, the environment changes, and every single day, what was a reality yesterday becomes an illusion today. And therefore, we need to interact with our document, know it very well, apply it to the context of our campuses, engage everyone, let no one be left behind, including our students during orientation. When they report, our new lecturers, our new staff should always be knowledgeable about our strategic plan, including our contracted services like our guards, security guards, our cleaning services, so that everybody is reading on the same page to enable us to achieve this strategy. Remember that nothing remains static. When KMTC relaxes and begins to be complacent, other organizations overtake us. And therefore, for us to remain sustainable and competitive in our environment, we must continue to reinvent ourselves and work harder than everyone else, be more disciplined than any other person, and show up every single day to ensure. I'm happy with what you people have done. I've seen DTA has really answered most of the questions. I have had also suggestions that are being made, like having 2 graduations, and being able to look at sustainability in terms of shortage of staff, HNDs and transcripts, and I believe that the answers that have been given by DDA are adequate, but still we will be able to welcome any further suggestions and views in terms of ensuring that we accommodate the views of our stakeholders in the endeavor to make our strategic plan a live document rather than a document that is in our shelves. Thank you, DDA. Thank you, our principals. I'm very proud of you. I'm very proud of you, our participants. And I want to take it back to the DDA.
Madam DDA, kindly unmute. Sorry.
Oh, so sorry for that. Sorry. So, yeah, what I had said, I was thanking the CEO for the comments. And then I was saying there are a few questions from members of the community that have been brought to my attention, and maybe it would be good to look at them specifically. One such, we have a committee from Maxim Market, and they are present in this meeting. They have, I can see 5 questions. I know some you have searched on, but I would want you to just address these questions. Number 1, how do you relate to the local environment to your training programs or curriculum development, noting that communities and societal culture differ, and even the common diseases vary? So how do we make sure we are looking at individual communities and addressing things of interest to them? You can answer that together with number 2, which is asking, how do you intend to incorporate or introduce traditional patient attendance practical training, especially maternity cases, since most of KMTC campuses are in major towns? So the second question about particularly to improving maternity services, especially about patient-centeredness. And I can just maybe point out that we have like a new curriculum on patient-centeredness, specifically addressing the needs of patient-centeredness. In the first place, we are applying it is to antenatal mothers, and soon we'll actually be getting the report from the various hospitals we've begun. Antenatal mothers getting better care because of this patient-centered training. And I think it's being asked because we know there are problems with maternity cases. Sometimes people don't get treated well. So the question is, how do we incorporate that? So maybe you can take those 2 first before I ask the next 3. Dr. Kelly. Okay. As he comes on, maybe I can answer them and say we have. He mentioned we've had like the border training. This is how we are community facing, looking at issues affecting the community. For example, we know if you are injured somewhere, either at home or on the road, or you have an emergency, the person who will be called first is likely to be a border person, the one who will stop by your place. So what we are trying to do is to train border in various areas. We have begun by training them, for example, what to do if they are caught and there is maybe an accident scene, what to do. Also, if they are caught maybe at home and there is somebody who is choking, maybe they were eating and they have choked, what would they do? Or another emergency, we have done that. And while I'm at it, could Francis, could you make the CEO a panelist so that he's able to join, to rejoin as a panelist? So so that what we are doing is to look at communities. They have different issues. We want to train people to address them. So this is how we are relating to the local environment. We also have community health promoters. We have health workers who are working in different environments. Like we know, for example, we have people along the highway. We know the problems that they face along the highway. We also know those people who are in a very remote area away from any road and any health facility. So what we want to do is to really train people in the community, the layperson, parents. We are looking to having non-traditional, students, like what we are saying. So even women groups, there's a course that we can train, but parents, because an emergency can happen at home, we'll be training them. So this is what we're looking to do. Number 2 is the patient attendance practical training, the patient-centered care, really important. And I have mentioned that we have a new short course on patient-centered care, and we are doing it in various facilities and checking. We are going to ask antenatal mothers in maternity whether it has improved their care, because we will train the healthcare providers and then find out if the care has been improved. We also have additional short courses, like, for example, healthcare assistants and so on, to see that the needs of patients are attended to. And we are happy to have more input. The next question that I'll just read out is a question that now that the world has become a global village in terms of internet connectivity, what efforts is KMTC making to introduce online classes, for broad coverage, except for the practicals, and to also enhance efficiency and accuracy? I believe this one, the CEO had answered that we are using e-learning. We have gone online. So this is something already we are doing. Maybe, I don't know that Dr. Kelly is in now. We can talk about that. Then the other one is, what plans does KMTC have to reach out to the needy and disadvantaged students who cannot sustain themselves in terms of fees? So the issue of finance, how we are addressing it, Dr. Kelly will mention that. I also see there's a student who had also asked a question related to that. So let me read it. Jacob is asking that I am following the session. I'm a student and I would like to be granted this opportunity to ask this question kindly. My question is not touching on today's topic, but I'll feel relieved if I get an answer. My question is on the issue of the student help loan. We have been getting good support from help loans, but as I talked now, I am in March 2023 diploma class. I applied for help to help me clear fees, but up to now, the status is waiting for allocation. Any update on these or finances, because we are nearing our final exams, and how will we sort our areas? So I can say we can combine that question with the one I had just read about student financing. And then there's a fifth question that I will also read, that during this strategic plan period, 2023 to 2028, what are your projections of opening new campuses? And what are the priorities? What are the projections? What are the priorities? So those are questions from the Massey Market Committee, and also from a student. Do we have Dr. Kelly on? Francis?
Yes,
yeah.
I'm here.
Okay.
I'm here.
Mm-hmm.
Let me first appreciate that we are having a conversation that is wider than the traditional KMTC fraternity, and that is why we have Massey Market fraternity as part of this conversation. We are very happy to have you, and indeed, as I can say, KMTC is a responsible corporate citizen, and engagement with stakeholders and hearing and listening to their views then enables us to make more informed decisions and be able to evaluate ourselves whether the services we are offering match their needs or the expectations. Now, the first issue that has been raised is on the issue of how do we relate to our local environment with different disease patterns and demands. Now, I want to say that Kenya Medical Training College is very, very, very sensitive to environment changes and demands of our stakeholders. Just today, the whole morning, we have been engaging with the county governments through Intergovernmental Consultative Forum, the highest organ that enables national government to discuss issues with county governments in relation to health matters. Remember that health is devolved, but policy and training are at national level. And at the same time, the Intergovernmental Consultative Forum brings into play issues that affect both county and national government. And therefore, KMTC has deliberately been part of these conversations to be able to listen to the wider demands of counties and be able to address issues that come from time to time. Now, the major issue is that counties are not homogeneous in terms of disease distribution. They're not homogeneous in terms of demands for health. They are not homogeneous when it comes to the patterns of human resources for health. And what we are saying is each county is unique with different demand than the next county. As had been elaborated by Dr. Nyawera, some counties, for example, along the transport corridor, are vulnerable to road traffic accidents. There are counties which are vulnerable to lifestyle diseases. There are some counties which are vulnerable to infectious diseases. Counties around the border are vulnerable to pandemics that are cross-border. And therefore, each county has its own unique demand for human resources for health, unique demand for KMTCs that exist within that region. And therefore, what we do is to consistently engage with counties to design courses that are specific to the demands of the county so that we're able to support them. Secondly, we are also cognizant of the fact that KMTC operates within the community. Communities have their own unique expectations of KMTC that may not be translated from one community to another. And that is why we encourage our campus principals to consistently engage with communities, even have Nyumba Kumi initiatives that then allow them to have consistent engagement with local stakeholders in terms of where can we work together for the common good. So we want to listen to the views of Masi market, and then be able to also see how we can incorporate them into our whatever we do on a daily basis. But more specifically, I want to say that we will be very responsive, and we will continue to be a listening institution in terms of being able to apply solutions that are local in nature to support communities where we work and have our campuses. Then the issue of incorporation of patient attendant training, improving maternity. We have now a 6 months course, a short course in that supports in patient attendance, and we also have noted we have courses that are geared towards maternal, newborn, and child health, and that is like the enrolled community nursing course, which focuses on arid and semi-arid regions of this country, where skill deliveries is still a big dream, and where we must be able to train with the support of local county governments to enable people and expectant mothers to have all antenatal visits, deliver in with skilled birth attendant, and then be able to ensure that the child survives the first 5 years. So KMTC is very keen in this area, and we have trained, and we continue to train. For example, right now we are training together with AMREF 300 and 73 chiefs, and we are training them for 6 months to empower them to be community health assistants. The reason for this is to make sure that we are able to support primary health care and make sure that we strengthen primary healthcare networks so that we have a stronger system that prevents diseases than react to occurrences of diseases. Then we also look at the issue of the student, and I want to appreciate this, has really looked at the matter of asking about how do we support needy students and disadvantaged students. What is the status of help? This is a very good question. I will start with the first part of looking at needy students and disadvantaged students. We as KMTC realize that for us to have a close to 100% completion rate, we must put in place mechanisms to support needy students who may not be able to have enough fees to pay every single semester. And therefore, we work with partners. Now, right now, we have partners like Ratansi Foundation that is supporting and welcoming applications for needy students to apply and then be able to be sponsored. Organizations like Kamili are supporting mental health through sponsorship of training. We also work with county governments to have a financing mechanism for students. We work with county governments to have a financing mechanism for needy students. For example, we've succeeded with Wasingishu and Kakamega counties, and we also have succeeded partially in Nyamira College. So we continue to do this through partnership and collaboration to support our needy students. We also have a very strong alumni network, and we have now noted that the strength of alumni can be harnessed to support needy students, and therefore we annually have Alumni Day in October. And we set the date early so that alumni can identify together with student leadership those among our students who are needy and need financial support to go through school, and we'll work out mechanisms that support those needy students, and then they go through school successfully. Then we have the issue of help. We, as Kenya Medical Training College, made arrangements through Treasury to support needy students through financing for help. Essentially, this fund is a revolving fund that enables students to be able to apply for help loan and then be supported to be allocated this help loan. As you are aware, there's a nationwide review of student financing mechanism that is affecting tertiary institutions. Kenya Medical Training College is a public institution which is also affected by legislation that takes place in this environment, particularly right now, because of the challenges of the health, the finance bill, where organizations and the government lacked mechanisms for financing the budget. There has been a delay in remittance of help financing to support students. We, as Kenya Medical Training College, have noted the delay, and we are working very closely with the Treasury. We have met with the Parliament, we have met with the Ministry, and we have also right now are engaging Treasury very actively in order to ensure that this financing is released in time to support needy students who do want to benefit from it. The delay is because of the challenges that existed early or in the middle of the year that then interfered with the normal budgeting process and financing of the budget. But we, as Kenya Medical Training College and the board, the management are cognizant of this fact, and we continue to engage Treasury so that the money is released to enable students to continue with the learning. Then the issue of projections of opening of new campuses and what is our our direction. Recently, the institution received a moratorium from Cabinet disclosing that we need to be able to manage expansion. And this means that we will not, going forward, issue new approvals for establishment of new campuses. However, there are those campuses that are in the process of completion, and they have been built using public resources and finances. And therefore, what we are doing is make budgetary provisions for their uptake once they are completed. And the budgetary provision here means equipping, furnishing, and making sure we have human resources that are adequate to operationalize those campuses that will be taken up by KMTC. But going forward, because of the moratorium, we will not be giving approvals to start new campuses, so that we are only able to take up those which are in the progress of completion. Thank you. I believe that unless there's one that remains unanswered.
No, you've answered them. Thank you. Thank you very much. Thank you for those answers. And thank you, Mercy Committee at Mercy. I know that we have many other stakeholders that are present and possibly have been listening. I hope we have managed to answer some of the questions that you had. But I will now call Principal Margaret Juma to recognize our stakeholders. I've seen your comments. I've seen you thanking for involving you in this meeting. We really thank you. So Principal Margaret Juma, you could acknowledge the stakeholders and then take it from there so that you now conclude, just in concluding. And I thank you all who have attended.
Yeah, thank you so much, our CEO, our DDA, and our risk manager for the remarks that you have made that are very useful to all of us. To our stakeholders, we want to appreciate you for being here. I want to begin with the stakeholders from Buvo, Governor Makueni County, His Excellency Mutula Kilonzo. We also have MP Makueni Central, Honorable Susan Kiamba. We have Mr. Maneno, MCA Kasonzweni, Madam Kaloki, DCC Kasonzweni Ward, Mr. Dominic Mnyao, Chief, Buvo Location, the Manager, National Bank, Water, and Evans Mutie, KFS Kibwezi. From Nairobi, thank you for being with us. We have Mr. Bernard Ondari, Chief Radiographer, Kenyatta National Hospital. We have Mr. Isaac Ndege, Chief Radiographer, Ministry of Health. We have Mr. Martin Kamanda, Radiology Manager at the Nairobi Hospital. We have Mr. James Kenyanya.
You're muted, Principal, now. Please unmute.
Sorry for that. Okay. I will quickly begin again, kindly. We want to appreciate the stakeholders from Buvo campus. We have the Governor, Makueni County, Honorable His Excellency Mutula Kilonzo. We have Madam Susan Kiamba, Honorable MP, Makueni Central Constituency. We have Mr. Maneno, MCA Kasonzweni. We have Madam Kaloki, DCC Kasonzweni Ward. We have Mr. Dominic Mnyao, Chief, Buvo Location, and Manager, National Bank, Wote, and Mr. Evans Mutue from KFS Kibwezi. From Nairobi, we have Mr. Bernard Ondari, Chief Radiographer, Kenyatta National Hospital, Mr. Isaac Ndege, Chief Radiographer, Ministry of Health, Mr. Martin Kamanda, Radiology Manager, Nairobi Hospital, Mr. Jevas Kenyani, President, Society of Radiography, Kenya, Mr. Kenneth Kariuki, who is the Regional Sales and Marketing Manager, Healthcare, and Mr. Anthony Mamati, Regional Sales and Marketing Manager, Mindri. We have from Machakos, that is Director Neema Machakos, the Salvation Army Machakos, CC Health, Mr. Kasiva, CEO Level 5 Machakos Hospital, Madam Winnie, Massmart Manager Machakos, Mr. David, KCB Sales Manager Machakos, Tumaini Hospital, Director Agriculture Machakos County, Mr. Eric Ndemange, Retired Principal Chief Machakos, contracted lecturers, staff students from Machakos, Engineer John Nderitu, County Director of Housing Machakos, and the chairman and committee members of Masi Business Community. From KMTC Makindu campus, we have the area MP Kibwezi West constituency, Honorable Mutuse. We have the Assistant County Commissioner Makindu, Madam Shikuku. We have the Chief Officer for Health, Makueni County, Dr. Ndolo. We have the OCPD Makindu, Mr. Jason Paul. We have the manager KCB Makindu branch, Madam Catherine. We have the alumni chairperson, KMTC Makindu campus chapter. We also have the sub-county education officer, Kibwezi West, Mr. Abraham, and all other distinguished and invited guests. As we head to the end of this town hall session, I want to so much appreciate our CEO for finding time to be with us here. CEO, you have really unpacked the strategic plan. You have even made it to us more easier. We've had a very actually deeper understanding of the strategic plan that will also help us implement it to the best of our knowledge. Our DDA, Deputy Director Academics, Madam Dr. Nyawira Mwangi, is also a member of the committee that developed this strategic plan. We actually thank you so much for a strategic plan that is very result-oriented, and we commit that we shall be able to implement it as guided in this plan. We also want to appreciate our risk manager, Mr. Edwin, for reminding us all what is written here. We should also be looking at risks, not because we want them, but we want to make sure we are able to mitigate them in advance so that they don't come to our side and we are unable to implement our strategic plan. Our stakeholders, our alumni, our students and staff, I want to appreciate each one of you for committing this hour today, for being with us, so that as the principal cascade it down to you, this strategic plan, you are here, you've heard all what we are expected to do, and it is not only for the managers. The strategic plan is for all of us, and we shall all be able to implement it. To our panelists, I want to thank you so much for a commendable and interactive session that you've had. And we have also showcased that you are able to implement our KMTC strategic plan even beyond expectations. Thank you so much for being available for our college and articulating the strategic plan well. Now I want to call up, we want to end this session with a word of prayer from one of our staffs from Machakos campus, that is Madam Caroline. Madam Caroline, kindly end for us with a word of prayer.
Thank you. Let us pray and to thank God for this opportunity. All protocols observed. Let's pray. We pray for blessings upon all of us, the Board of Governors, the CEO, the senior staff, our stakeholders, KMTC staff and students, and all participants that are present today. We are grateful for a wonderful session and that was meant to increase our awareness regarding our strategic priorities and program. We want to pray that the Lord will give us sufficient grace as we undertake this strategic plan. I pray for a successful implementation forward and blessings upon all KMTC fraternity in this process. Together we pray that we shall achieve. It's through Christ our Lord we pray. Amen.
Amen.